The ESC 2020 Guidelines on Diagnosis and Management of Atrial Fibrillation, developed in collaboration with the European Association of Cardiothoracic Surgery, or EACTS, were presented on day 1. The guideline propagates the atrial fibrillation better care, or ABC pathway. A for anticoagulation, or avoid stroke, and includes anticoagulation medication to prevent stroke except in patients at low risk. B for better symptom management that suggests controlling heart rate and heart rhythm with medications and procedures. C for cardiovascular and comorbidity optimization, that is management of other conditions such as high blood pressure and lifestyle modifications. Olivato presented the findings of Explorer-HCM trial, which proved that mavacamten is a promising drug for symptomatic relief and functional classification improvement with left ventricle outflow gradient reduction in selected patients with hypertrophic cardiomyopathy. Mavacamten might be the first choice in elderly with careful dose titration. Mavacamten might also be useful in young patients with high troponin and pro-BNP values. Packer presented the most awaited findings from EMPEROR-Reduce trial. It was confirmed that empagliflozin reduced the combined relative risk of cardiovascular death and hospitalization for heart failure by 25%, and the relative risk of first and recurrent hospitalization for heart failure by 30%. There was a slow decline in the estimated GFR in the empagliflozin group versus placebo. Furtado demonstrated that in the declared TINI trial, patients with type 2 diabetes with severe hypertension experienced a greater benefit with dapagliflozin for hospitalization for heart failure and had consistently reduced renal events with dapagliflozin across all levels of systolic blood pressure. Philippe presented a study in which, astonishingly, it was observed that low-dose colchicine markedly reduces the risk of ischemic cardiovascular events in patients treated with PCI for their index myocardial infarction. ESC 2020 Guidelines on Non-ST Segment Elevation Acute Coronary Syndromes recommends to use the ESC 0-hour or 1-hour algorithm or the ESC 0-hour or 2-hour algorithm if a high-sensitivity cardiac troponin test with a validated algorithm is available. In patients with non-ST elevation ACS at low risk for cardiac arrhythmias, rhythm monitoring up to 24 hours or the percutaneous coronary intervention, whichever comes first, is recommended, while monitoring for more than 24 hours is recommended in patients at increased risk for cardiac arrhythmias. Professor Hito presented the much-awaited DAPA-CKD findings today. He revealed that dapagliflozin demonstrates 39% reduction in the risk of declining kidney function, the onset of end-stage kidney disease, or death due to kidney failure. Jorn presented the finding from the popular TAVI trial today. He stated that aspirin alone, as compared to aspirin with clopidogrel, reduced the bleeding rate significantly, with an absolute reduction of more than 10%, without increasing thromboembolic events as captured in the secondary outcomes. The trial shows that aspirin alone should be used in patients undergoing transcatheter aortic valve implantation who are not on oral anticoagulation and have not recently undergone coronary stenting. The ATPCI trial presented by Ferrari assessed the efficacy and safety of trimetazidine added to standard, guideline-recommended medical therapy in patients who had a recent successful PCI for stable angina or non-ST elevated myocardial infarction. It was observed that the prophylactic use of trimetazidine added to the recommended medical therapy did not improve the symptoms of angina, hospitalization for cardiac events, and death from cardiovascular causes in the ATPCI population after a successful elective or urgent PCI. The first ESC guidelines on sport cardiology and exercise in patients with cardiovascular disease was presented today. The guidelines covers recreational exercise and competitive sports for people with heart disease, including AFib and/or conditions that elevate the risk of heart disease such as obesity and diabetes. Kazem presented a new research from the Blood Pressure Lowering Treatment Trialist Collaboration Study. The results showed a reduction in relative risk of major cardiovascular events by roughly 10% for each 5 mmHg reduction in systolic blood pressure. Risk for stroke was reduced by 13%, for ischemic heart disease by 7%. For heart failure by 14%, and for death for cardiovascular disease by 5%. Dario presented the result of ISAR React-5 platelet aggregation sub-study, divulging that prasugrel led to a more potent platelet inhibition compared to ticagrelor. The 2020 ESC Guidelines on Adult Congenital Heart Disease was presented today. Some key recommendations were: women with a fountain circulation and any complications are counseled against pregnancy. Routine imaging to assess for cerebral aneurysms in asymptomatic patients with coarctation of the aorta is not recommended. Regular liver imaging should be considered for patients with fountain circulation. Dr. Lopes presented BRACE Corona trial. As per the trial, patients hospitalized with COVID-19 can safely continue taking angiotensin-converting enzyme inhibitors and angiotensin receptor blockers. On behalf of the REAL-CAT study, Nagai concluded that after statin therapy with modestly controlled LDL-C, HDL-C level has little prognostic value in patients with stable coronary artery disease. With this, we conclude our 4 days coverage of exceptional updates from ESC 2020. Thank you for staying with us. Have a good day.